Good afternoon, everyone. I'm Gary Summers, and welcome to Mind, Body, Soul, a show about your mental, physical, and spiritual wellness. One of the objectives of this show is to introduce listeners to therapies we may have not heard of. I'm sure most of us have had a massage, but have you had a Rolfing session? It is a system of soft tissue manipulation and movement education that organizes the whole body in gravity. Research has demonstrated that Rolfing creates more efficient muscle use, allows the body to conserve energy, and creates more economical and refined patterns of movement. My guest is a certified Rolfing practitioner based in Grand Falls, Windsor, who graduated from MUN in 2000 with a bachelor degree of nursing, with experience in areas of neonatal and intensive care nursing. She is also a certified Zen yoga teacher. Welcome, Valisha Keough.
Hi, thank you. I'm honored and very grateful to be here.
Thank you, Valisha. So Valisha, can you give our listeners some idea as to what they can expect to hear from you today?
I guess it's not going to be difficult to understand, nursing and how, as a nurse, I like to help people and prevent and promote wellness and manage what they're dealing with. But now I've added something to that called Rolfing Structure Integration, which sounds really strange to everyone, but it's named after Dr. Otto Rolf. So we have Rolfs here in this province too. So it's just a surname. So if we can kind of get over the strange name of it, it's all about the fascia system in our body. So I'd like to explain a little bit about what fascia is and why it's important to keep it healthy. And then when we do keep this healthy and we have a more organized fascia network that can support us, how that can keep us more stable and stronger and freer to do the things that we love to do in our daily life. So that's kind of in a nutshell what I'm going to talk about today.
So let's get right into what is fascia.
Fascia is a connective tissue in our body, and what it does is it wraps around things like our blood vessels, our nerves, our organs, like in between bones. It's basically a sensory communication network organ that weaves in throughout all of our bodies. So if you were to picture a spider web, you never really know where it begins and where it ends, and a raindrop that would hit a spider web. You can see that wave through the whole web structure. So that's what our fascia is. Moose hunters, for example, or if you work with meat in a kitchen, you've actually seen fascia. You lift the skin, this white fuzzy stuff, and sometimes it's a thicker, harder fabric material, or it even looks like a sponge. So the basic idea that fascia is connecting us, our whole body together in and around itself. So that's a short version of what fascia is. It's a complicated network, but it impacts how we move and do things. Like if I were to use my shirt for an example as being one layered, because fascia is multi-layered, it's all throughout our body in all directions. But if we just take our shirt, for example, and if you're to tug one corner at the bottom of your shirt, and like I'm doing that now, and I'm seeing, lines that go in, different directions. And if I keep continuing to pull that or even twist it, how a knot forms, and I feel the tension, go up to my neck and shoulder and wrap around my side. So that's just one layer of fascia. And imagine if that is all, there's layers in all directions on top and around. So when we have, any type of injury or stress in an area, that fascia can get pulled and tugged and shortened and kind of bent out of shape, which then makes other things in our body not work so well. Kind of happens over time. Things we may not notice, any discomfort, we can still go on our daily life, but over time when the fascia isn't working well, then other things start to not work well.
Valisha, how does what you do with Rolfing fit into health prevention and management?
So when I think about prevention and management, I think about, working with this fascia layer, just like when I do things for cardiac disease and heart failure, I'm giving people tools to kind of help them stay well or have optimal function for as long as they can. So when I'm working with this fascia, it is a touch therapy. So I'm touching the skin and I'm able to affect certain areas in the fascia layers under the skin, but also now that we have an idea that this fascia is just not in one place, it goes everywhere, then I can affect other places with the contact underneath my hands, kind of it disperses, like I kind of gave that image with the spider web. It can disperse throughout the body from where I'm working to other areas. And it's done so in a way that, the client is participating in what I'm doing.
When you say participating, do you mean that the client is giving you feedback as to what they're feeling and sensing?
Exactly. So I probably jumped ahead a little bit, but what I do is, like, when I work with my hands, a client is on the table, and like in a massage, you can just relax and maybe even fall asleep. But what I do is, like, I want the client to be able to have sensations to talk to me, so that they start to connect body connect where things are happening. For example, I can touch someone's finger and they have sensations in their back, which I would never really connect a pinky, normally to a back, but that's how their fascia network has been tugged and pulled. That's how they are connected. So it's important that they pay attention to anything that they're feeling in their body, but also sometimes I may be in an area working, and then I'm going to ask them to do a small movement. On your feet, for example, we know how important our feet are. I might be touching their feet, but then ask them to do like a gentle toes up, or have their ankle start to bend slowly, as that starts to help move the fascia in a different way. But it also gets a person to be in their body, to experience it, and to know how to slow down movement, where things are going, and how things are connected within their body.
Alicia, we hear the term plantar fasciitis, and you talk about the fascia with Rolfing. I guess they're related, aren't they?
Correct. Okay. It is, yes.
So that's something that you actually will work on, people who have plantar fasciitis.
Yes, exactly. And we can get plantar fasciitis from different things that we do during our life. But what happens is that it shortens and it pulls, so it's not able to give us the length in our feet that we need for walking motion, for example. So what we do is I would the soft tissue manipulation of the fascia, but then also teach people, how to move their body, how to hold themselves when they're walking, so that they can not create that problem coming back, for example. It's like the movement education, the piece of someone learning the way that they're walking, for example, has created that plantar fasciitis, or the way you stand or lean can help, make that over time become a problem for you. If you look at the bottom of your shoes, have you ever noticed that they wear different? Because some people will walk on the outsides of their feet, or more on the heels or the insides of their feet. So our feet are, like you said, so important that the plantar fasciitis can be linked to, how we're holding our feet as we move every day. Or are we doing it because our ankle isn't working so well? Like, it fascinates me to learn that people complain of knee pain. And I always think now, because I'm a rolfer, it's like, well, knee pain, did they have an injury or something going on that their ankle isn't working well? Or is it further off? Is it in their hip, low back, and that's coming out as knee pain?
So, Valisha, can you explain to our listeners how Rolfing actually affects our fascia?
So Rolfing is a method of working with this fascia to help reshape it and reorganize, to balance the whole body. So it's a skillful touch. It works on certain sensory receptors in our body, but it restores that smooth function of fascia and all of the parts that it's connected to. So fascia helps things to slide and glide and work properly in our body. So, one of the techniques that we use is that it's almost like a gentle shearing of the fascia, how we contact the fascia. It's almost like a gentle shearing, so that can increase the movement of the fascia, and it expands it, so then it can lengthen and expand. But the fascia, when we work it, it actually helps to balance structures in our body. So when we think of, you're talking about feet, so some people, they have their feet turned in or turned out. And over time, it doesn't cause a problem right away, but then over time, things will rotate, the leg rotates, and that can rotate all the way up to the hip. And then you keep walking or running and moving, playing squash, whatever you do, the knee is the pain that you get. And that's all started way back when the feet were turned out. The ankle doesn't bend the same way. The fascia gets stiff and sore, and then it creates that rotation, and things are not able to move and slide and glide. Everything from the muscle how the bones are being held as we walk, right down to the nerves and everything. So then people can actually experience pain that started in their foot and ankle all the way up into their back.
Valisha, you sound really passionate
I love it.
about what you do. Can you just talk to the why? How did you decide to get into this? Because I think you've had some structural issues as well, that you went through some therapies that didn't really work for you, did they?
No, unfortunately, I've always thought I've been healthy, but I was an ICU nurse, so working 12, 16-hour shifts on my feet, high stress, high physical demand, and over time my body was showing wear and tear. I mean, even though I hiked, I did yoga, regular maintenance of massage and acupuncture and things, I ended up with 2 muscle injuries in my back that I thought I recovered from, and then over time I had this persistent pain that was in my hip, my backside area down to my leg, and it would take me days to get over after working, my 3 shifts. I would have pain, and I was like, I can't be 31 years old and still have chronic pain for the rest of my life. So I knew that there was something I had to do. I found Rolfing, and with moving my fascia around, that kind of helped reorganize how I held my leg, how I would move when I would do certain postures that were more supportive. I was able to balance out my pelvis. A lot of things were in my sacrum. My pelvis was off balance. And then I was able to take the things that I learned and then apply them to anything I did. I was able to hold myself in a more comfortable way. It was less effort for me to do the things that I was doing. I had more energy. I never had that pain come back because my structure was now more stable. It was more supported. I had more flexibility and length in all that fascia. So then everything else that's connected was able to move easier. So I just felt more comfortable in my own body. That's why I wanted to kind of make this available for other people. No matter if you're 10 years old or 84, we all want to be comfortable in our body, feel safe and supported, more stable, so that we can have the energy and the freedom to move.
And you have clients who are 10 years old and who are 84 years old, don't you?
I do.
So, Valisha, can you explain a little greater detail on the benefits of Rolfing?
So the benefits that we talk about and promote are the benefits of having a better awareness of your body-mind connection, which, goes so much further than I can even talk about right here today, but also having that stability in our feet, having dimension, we call it dynamic feet, so that it can do all the things that we like to do, whether it's running or playing golf or just walking when we're 84. We do a lot of things with our upper body that helps our breath feel just bigger, so we have more freedom in breathing through our lungs and things like that. Athletes, we always say that it can give them the peak performance. You don't have to have an injury, but if you want to stay well, it helps high-performing athletes to kind of keep really flexible and limber. There's just so many benefits of, using it as a supportive therapy to keep you comfortable in your body as we go through life at any age.
Valisha, you are the perfect example of what this show is all about, because if you had decided way back when that you had to live with this chronic pain and basically had given up, your life would have been a lot different today. So I just want listeners to really understand that there is a solution to all of life's problems. And if you live in hope and possibility and you keep looking, you will eventually find a solution to your problem just the same way you did, right?
Yes, exactly. Because, we're in this body from the time we're born until we're not. So I like to think, having that prevention and management of how we stay healthy. And it's not just from, regular exercise and the food we eat and things that we have to do. It's also through how we move, keeping that structure of our body stable and supported to help prevent falls and prevent injury, or when we do have injury, if our fascia is healthy, it helps us heal faster and get back to our functioning.
Can you explain to listeners how you perform Rolfing?
Sure. So the table that I use is very similar to what you would do as a massage table. And then, of course, like any new client, we have a conversation. Is how we start. It's like I review their history, their medication, what their life has been, because our whole life, I know now it's in our tissues, not just all the organ systems that we have, as I think of as a nurse now, as a Rolfer. It's like our whole experiences are in our body. So everybody comes with a different story. Everybody has different experiences. So we talk through that. And then when we actually do work, I start with an assessment, to see how things are moving, how the body structure likes to move and hold us up. And then we go onto a table where I perform some of my direct touch, and people may either just be taking slow, deep breaths to notice their body sensations, or they might be asked to move an elbow in a certain way, or just slowly bend a knee as I'm holding the fascia and letting it do its thing. And then after, there's a reassessment. So then the body can does it feel different? Is there something new? Do I like this new way of walking on the floor with a full foot, or I don't have knee pain now that you've kind of adjusted a few things, or I can take a deeper breath. So that's the biggest piece for me, is that movement education piece that comes with not just the direct touch of the fascia manipulation, but also the body awareness and the education that comes with learning how to hold ourselves easier in our upright posture.
So depending on how the client would respond to your therapy would depend on where you go with the next series of movement. Is that how I'm reading it correctly?
Rolfing is like a process. So, we usually do it in a 10 series format. Like, it's a protocol of doing 10 sessions, because we address a different part of the body to help it become more supported, more stable, more flexible, help it to adapt in the ways that it needs to in order to hold us in our upright moving or sitting even. So it's to help the body be able to sit, walk, and stand in an easier way. So the client kind of helps gauge certain things, like they're aware when I ask them to be aware of where I'm touching, and I want them to have no pain. That's a big thing. Rolfing was known to be painful years ago, but now that we know the brain science is, we want them to be engaged. So my contact has to be comfortable for the client, and that's what they help to participate in, as well as to make sure that it's being comfortable for them. But like for session 1, we start in like the rib cage and shoulder area. And then the second session for everyone will be from the feet up to the knees. So it kind of has a certain order to it. There's a method in how we address the body in a certain way to give it the support that it needs to be more stable and to function easier.
So, Valisha, can you explain to our listeners how Rolfing is different from massage, chiropractic, physiotherapy, those types of disciplines?
Okay, so it's a great question, and I guess I would like to say it's a complement to all the other modalities. It's another choice for people, and for me, the thing with Rolfing is specifically for the fascia. Like, we're not just looking at the bone structure. We're not just looking at the muscle structure. We're looking at the fascia and how that plays and interconnects, and can help reshape all those other structures when we work at the fascia level, because it is its own sensory organ. It is its own entity within our body, that it's different to just hands-on touch the fascia in all the different layers in a certain way, and then bring in that education piece, give people the tools that they need to become aware of how they can support themselves going forward, not just when you're in the office, what they can do when they're outside. And it's really interesting how many people aren't that connected. We're so busy in our outside world, we're not that connected with our body. So I like the body-mind piece, which kind of helps to center ourselves. It's a whole system, just like my nursing is very holistic. I like the fact that Rolfing is very holistic, and you don't just touch a body without touching a piece of, the emotional aspect of Rolfing. Our emotions can get stuck in our body and held, the happy and the sad. So that does play a role in how our body likes to move or not move. Those people that are sad or shy, they have a certain posture. So using the fascia helps loosen things up, so then they can choose, do I want to look straight up? Do I want to move in a different way instead of hunched over? How they want to greet the world. I love a saying that Ida Rolf has, the way you walk across the room is the way you walk through life. And that's so important on all levels of our body, the whole body, mind, spirit.
So, Valisha, just give our listeners an idea of how long a Rolfing session last, and typically, like, how the average person, how many times would that person need to come back to see you?
Okay, so it's usually 90 minutes, an hour and a half, because we do the assessment and then we reassess and then we do the hands-on education piece. And I did forget to mention that we use table work, but we also use bench work. And that's another big key for Rolfing. We have what we call our Rolfing bench, and it helps people get a new sense of how our feet are actually connected to our spine and how to use that. Our legs and our arms actually move from our spine. So we do bench work to kind of help people feel how certain bones and structures work in their body, but also to help connect our feet back up into our spine, because then it's easier to stand upright. We're upright beings, and when we find an easier way, our body wants to be efficient, because then it can worry about doing other things instead of trying to all that effort to hold us upright. You know, when we're hunched and curled over, that's a lot of energy that our body has to use to kind of make us move and walk and sit and stand. So when we actually give the body, invite it to find a new way, it does make it easier. So it takes about 90 minutes per session. And then, like I said, it is generally the typical protocol, standard of care would be, you know, a 10 series. But I mean, that doesn't fit into everyone's life. So I say, come in, try one. If it feels good and it connects with you, then at least sign up to 3, because when a person does that, the whole surface fascia of their body is freer, it's more comfortable, so there's a different stability already starting within their body after you complete 3. And then, you know, we individualize, just like I would for a nursing care plan, I individualize everybody's treatment plan and care plan, depending on what they come in with.
You mentioned earlier on how it complements the other therapies. This is something that you have to be certified in order to practice this?
Yes. So I actually gave up all my loved nursing jobs here and went to Boulder, Colorado. There's only 3 schools in the world to do it, Germany, Brazil, and Boulder. So I went to Boulder, and it was a year, and then I did some mentorship, and I actually stayed a little bit longer to do some practical training, would be like a work term, I guess you would say. So I was gone for 18 months in order to become certified and get the tools and the confidence to be able to bring this back home, because I am the only Rolfer in Newfoundland. There are about 70 Rolfers in all of Canada, and it's all over the world. This is not brand new. It's been out for 60 years, and it's a global thing. We haven't heard much of it in Newfoundland for sure.
Do you have any good stories to tell us about? I'm sure you must have clients who you've changed their lives.
My 10-year-old is amazing because they're so active, but it's interesting to see how their posture habits are already forming. And I can see such a change in her. She sits easier and she walks differently. She has a different smile, but then she has her hockey coach say, I don't know what you're doing, but your performance has greatly improved, the way you can skate across the ice and handle the stick. And that's things that we've been working on here in her Rolfing treatments, is, you know, things that she was finding weren't very comfortable as she was skating or dancing and things like that, because she was really active. And then I have some clients who their pelvis had issues. They weren't able to conceive, and I don't want to put any disclaimers out there, but for them, they were actually pregnant within 3 months after their Rolfing process, because their body was more supported and aligned and functioning in an easier way, that other systems in their body were able to function, and they actually became pregnant after a long time not being pregnant. And then some of my older clients are finding it really hard with their mobility right now, or fears of falls, and they're just finding that they have a new sense of being able to stand and balance themselves in a new way. Like they feel like they're standing taller, easier, and they're not as tired, and they're actually doing activities, doing stairs and things that they've never done in years. So I guess they're my success stories.
Valisha, can you leave our listeners with something that they can use right now to help them?
Just be open to learning about how your body is moving. Be more aware, because then there's an opportunity for making change that will improve and support your long-term health, your mobility, and your energy. And Rolfing is one of the ways to do that. You know, keeping our fascia happy and healthy means that things can slide and glide and increase the movement of the whole body, so you're feeling looser and greater balance, and sitting and standing and walking with more ease.
Valisha, if people wanted to get in touch with you, what's the easiest way?
So I have a website that they can check it out. It's www.align, A-L-I-G-N, Rolfing, R-O-L-F-I-N-G, time, Time.com. So Align Rolfing Time. And they can call me. I give free consults, 15-minute consults over the phone, in person, and that's 489-3395 or 486-2389.
Thanks, Valisha. You've been a wealth of information. Thanks for taking the time to be on the show. That's it for this week, everybody. Next week we'll have another great guest for you. Bye-bye for now.